What have you come in with today?
Oh, doctor, I've got it.
Dr. Peter Goyder has been a GP in St George for 25 years. In that time, a lot has changed, not least the demand on healthcare over our colder months. During busy periods, he can have up to 90 appointments a day with patients, either face-to-face or over the phone.
The pressure is going up year on year in terms of numbers that are being seen and the complexity of patients being seen in the community. It's a fine knife edge which we're walking at the moment. I am really pleased I'm a GP in Bristol because I do believe that Bristol GPs, Bristol practices and the system in Bristol is actually a safe system. But there are big risks in terms of being able to deliver that in the long term.
This surgery has a robust plan to ensure that patients get care where they most appropriately need it. And this starts at the front desk with those who work on reception.
If the patients can speak to us and tell us a little bit about their problem, we don't need any in-depth information, then it helps us guide them to the right area and make sure that they can get an appointment to see somebody as quick as possible.
Over the winter, all GP practices are under increased pressure, not least so this one. Last winter, the demand for appointments here was up 100%. Normally, 40 patients are seen a day by a GP on an urgent basis here. In winter, this rises to around 80 patients. The number of telephone consultations increase more than threefold, from 30 a day to up to 100. And that's just for the 13,500 patients that this surgery serves.
The only way that we can see more people in general practice is for more people who have self-limiting illness to be seen by pharmacies and through self-care. So it needs the whole system to be working in a different way.
And this winter, an urgent care review by the government means more work will be falling onto the desks of GPs as they try to prevent people turning up at A&E who could have been seen by a doctor in the community.
If things are getting worse or you're not sure what's happening, then do come back to us.
But will this be too much for a service already pushed to its limits?